I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who have not kept them. I don't want money. I don't want cars. I don't want money. I don't want cars. You are, they tell me the best is too fast. The truth, wrapped up in excuses. You are the weeds that pull their group back. The strings upon my heart, but you know that. Cause you pull them, yes you pull them till they cry out.
Hello, everybody. Good evening. I am so happy to see you guys. Welcome back to another episode of Sisters Against Kidney Disease, and I am your host, Audrey Bella Langston, and I just want to take a minute to thank each and every one of you. Of course, I want to thank my regular guests who are generally always on here, and I want to thank my new guest. And please, while we're here, be sure to hit a like. I want to hear your comments for this show, guys, because it's going to be a great show. Please ask your questions, and we want to know your thoughts. Thank you so much again for tuning in. So our first two shows, we had not only my story for the first one, but also a great story about a wonderful couple who the husband received a random donation as an act of kindness on my last show. And in my first introductory show, I think I shared that there is no bars hold here. This is, even though my show is called Sisters Against Kidney Disease, this is also for my brothers. So I want all men to chime in, because I know you guys can be a little difficult sometimes getting through to you, and we just want to show love to all of you guys. Also, I would like for you to tune in not only to my show, but to my partners as well. Steve Belcher from Urban Outreach Media, my producer and buddy Jared Brown from Warriors Quest, Jim Myers, the Lisa Baxter Show, Tamika. We are all out here fighting for the same cause, and that is to enlighten all of you and educate you not only on the importance of kidney disease, but also tonight, which is going to be our focus, about diabetes. Guys, this is really, really serious, and I hold this dear to my heart, because right now there are over 100 million people in the United States alone that suffer from diabetes, from one form or another, and there's several forms, and we'll get into that later. Out of that 100 million, over 60% are African American. And African Americans as well are more likely at 3.5% to be diagnosed with end-stage renal disease. I know I can testify to it because it happened to me. Not only did I succumb to kidney disease, but recently, as of last year, I was diagnosed by my nephrologist with type 2 diabetes. Now, let me just say a little bit about that. A lot of things like these type of illnesses can be prevented, especially diabetes. And I'm going to let my educator share that part with you. But some of us, these things happen because of other illnesses that lead us into it. Now, this is the case with my situation. My A1C started to go up a little, and then he, in lab work, checked my blood work and my glucose level was elevated to a point at which it put me in a type 2 diabetes category. That happened more than likely because of two things. The Prograf, with regard to us recipients, okay, can be a beast, especially prolonged use of it. I am, praise the Lord, almost 16 years post-transplant. But the flip side to that coin is that it can cause these type of things, such as diabetes. And that's what sent me into that, as well as the fact that I am genetically predisposed to it because my grandmother was a diabetic and also had kidney disease. So guys, this is what's really important. We some things we can't help, but this, we are seeing disproportionately staggering high numbers here because we are not doing really the things that we need to do. We need to eat better. Most people, everything is about quick meals. We used to sit down and have wholesome and nutritious meals. Remember when we were kids? Our parents, our mom cooked, our grandma cooked. We are eating fast foods, processed foods. All of these things are not good for us. And in the interim, not getting enough exercise. We are destroying our own bodies. This temple, we are destroying our own temple. And we want to get this word out to you. I want to get this word out to you to stop it. Stop it. There are children who are diabetics, many of them. Come on, kids that are obese, because they're not being fed properly. They're not eating enough vegetables and fruits and healthy foods and just being able to eat treats at will whenever they want them. It needs to end. It needs to end. And so that's why I wanted to have an educator on here tonight to talk to everyone and to give us an education on diabetes. So I want to share a little bit about my speaker. Her name is Laura Gil, and Laura's been employed at Tampa General Hospital since 1989. Whoop, whoop. You know I'm a TGH girl. She started out by working in the transplant unit, and she remained in that unit for 7 years when she became inspired to pursue a nursing degree, which she acquired at the University of South Florida. And she then became a certified diabetes educator. She was mentored by someone who was already in that department, and she decided to do it as well. And I'm so happy she did, because she has now been teaching patients in the education of diabetes for 16 years. So we know she knows her stuff. Also, Laura and her husband have two beautiful daughters that they adopted through foster care. This warms my heart. It really does when people do this, because we have so many children in the system. And my bestie in Chicago is an adoptive parent, Michelle Colbert. She has 3 adult children of her own and 6 adopted kids. So shout out to all the wonderful adoptive parents. Cool. So let's bring Laura on and give her a warm welcome. Hi, Laura.
Hi, Bella.
Welcome.
Thank you so much for having me on the show. I really appreciate it. I actually have 4 adopted daughters. So yeah.
Wow.
Yeah.
That is so cool. I apologize. I thought I said 4. That is so awesome.
It's a blessing.
Wow.
It's a blessing.
How old are they?
They're age 15, 13, 12, and 10.
That's so amazing. I love that. I so love that. Congratulations to you and your husband.
Thank you.
Yeah, so thank you for coming on, Laura, and I'm going to get right into it. My first question I would like to ask you to share with everyone. Explain, I think it's important for everyone that doesn't already know. I'm sure we have quite a few in the audience who have diabetes. I was just sharing with them that I myself am type 2. It's believed pretty much that it's possible that the Prograf led me kind of into it, but also my grandmother was a diabetic. So I say it probably came from both aspects. But please explain, what is diabetes? And if I'm not mistaken, there's 3 variations from pre-diabetes to type 1, type 2, which I believe is the type 1 is the insulin dependent one, if I'm not mistaken.
That you're correct. And so there are several different types of diabetes. There's type 1, which usually occurs in children or young adults, but it could occur in older people. And that's where the pancreas doesn't work anymore, and those folks need insulin injections for life. And the second type is type 2 diabetes, and that is the most common. 90% of people with diabetes have type 2. And there is a genetic component to it. It usually runs in families, persons that are overweight, or older adults. Now, with the transplant, what happens is the medications Prograf and prednisone can cause medication-induced diabetes. However, that's not true for everyone, and folks that have a risk factors coming into transplant, so if they already had a family member with diabetes, it's more likely that they will go on to develop type 2 diabetes. And there's also gestational diabetes, which occurs only during pregnancies. So type 1, type 2, gestational, and pre-diabetes, which is kind of like a precursor to type 2 diabetes. Now, this type pre-diabetes, if treated right away, if a person knows they have pre-diabetes and they go ahead and start eating healthy and exercising, and some practitioners will actually go ahead and prescribe a pill called metformin, they can actually delay the onset of type 2 diabetes if they go ahead and start making those necessary lifestyle changes ahead of it.
Okay. Now, and that's what I'm on, the metformin.
Yes.
It doesn't, if I'm not mistaken, really necessarily lower the glucose. However, I believe more so, like you said, prevention, keeping it from escalating.
Well,
if I'm not mistaken.
The metformin helps keep the liver from overproducing sugar. So it doesn't actually like stimulate the pancreas to make more insulin. It just helps, the liver from overproducing sugar. So that your sugar is regulated in that way. So it's metformin is first line with newly diagnosed type 2 diabetics for a lot of good reasons. It is very effective at lowering the A1C, and it is low cost. It's free at Publix, and it doesn't cause weight gain, and it doesn't cause hypoglycemia, which is low blood sugar. So lots of good things about metformin, and that is why the American Diabetes Association recommends that one first line for newly diagnosed type 2 diabetics.
Okay. Hi, Candy. Candy is saying that she was diagnosed with type 1.5 because of how her liver and pancreas were working. So I actually, I take metformin, like I said. I had to end up switching to the ER, extended release, because the first one was not working with me. I was having a lot of digestive issues because of it, and I know it comes with a few of those side effects. So I think it kind of course, will vary from person to person, but yet it does seem to be doing its job. Now, you mentioned gestational diabetes, and you said that that's primarily in regard to pregnant women. Does that mean that the the mom had diabetes prior to conception, or she acquired diabetes while during the pregnancy?
Yes. So the placenta is making these hormones that cause this gestational diabetes to come about. And once the baby's born, so it comes on like during the third trimester of pregnancy. And once the baby's born, the diabetes goes away. However, the person has a chance of developing type 2 diabetes in the future if they don't, implement lifestyle changes. So within the next 5 years, they could go ahead and develop type 2 diabetes.
Wow.
So they're at higher
Wow.
risk. That's one of the risk factors. You mentioned family members, but having a history of either having a large baby, giving birth to a large baby, over a 9-pound baby, or having a history of gestational diabetes can cause type 2, is a risk factor for type 2 diabetes.
Wow. Okay. So, can you tell us what are some of the warning signs, or i.e. symptoms, that our blood sugars are too high, and what do we do if they are elevated?
So some of the symptoms are being tired, thirsty, blurry vision, frequent urination. Some people get headaches, and the main ones are the thirsty, frequent urination, and drowsiness. Those are probably the main side effects or symptoms. I'm sorry. And if like a lot of people that we see in the hospital, they know they have family members with diabetes. They see them checking their blood sugars and talking about diabetes. So they will ask their family member to check, and they'll find out that their blood sugars are actually high. So I would recommend, if you know that you have risk factors for diabetes, to definitely make an appointment with your doctor and find out what your A1C is. You mentioned A1C, and find out what your fasting blood glucoses are. The ADA recommends the goal for A1C to be less than 7 for most people, and your fasting blood sugar, fasting, of course, it means first thing in the morning before eating any food. That number should be between 80 and 130
Okay.
for folks with diabetes.
Okay. I think that too, a lot of people have the misconception that this only happens to people who are overweight. Majority of people who are overweight or who really have terrible eating habits. And you can correct me, that is totally not always true. I've met some people who were in great physical shape. I mean, work out, eat good, and they came down with diabetes.
Yes, and you are correct. You're 100% correct. My mentor has, diabetes, and she won't mind me telling you all. She tells everybody. But she is nice and thin, and she watches what she eats. She always have. I mean, I've known her for over 20 years, and she's never been overweight. She's thin. She takes metformin. She controls her diabetes with metformin, and she has diabetes because it runs in her family, and once you get to a certain age, it just comes on. It just depends on the person and your genetics. But yes, and there's also a misconception about type 1 diabetes. A lot of people might say that type 1 diabetics are usually thin, and that is true. However, there are type 1 diabetes, or persons with diabetes that are overweight as well. So you can't really look at the clinical picture without digging a little bit deeper. Just by judging simply by what you see. Is a person overweight, or if they're thin, if they're old, if they're young, like you said, even young people. We're seeing teenagers with type 2 diabetes due to obesity and metabolic syndrome, high cholesterol levels, because we don't we live in a fast food world, and everything we need to do it right now, and we're not sitting at the table. We're standing up eating, and
Yeah.
I mean, just not eating all the fruits and vegetables and healthy things that we should be eating, and teaching our kids to to eat that way as well. And so, like you
Absolutely.
said, just you have like complete access to all of these sweets and snacks and things, and it causes childhood obesity, unfortunately, which is a big problem in our country.
Yeah, and so then in saying that, there are a lot, I'm assuming probably you see a lot of children, because that really bothers me with the babies. You know what I mean? I mean, they're so young to have to go through something if it's unnecessary. You know what I mean? And are you seeing a lot of type 1 children that are actually on insulin?
Well, all type 1, when at diagnosis, they get insulin because remember, with type 1, the pancreas doesn't work anymore, and they have to have insulin for life.
Mm,
So whether they're diagnosed as an infant or as a 20-year-old, the treatment is always insulin. Now with type 2, if we have a 12-year-old, who is 5 foot and weighs 180 pounds, they'll likely be started on metformin. You see, as
okay.
long as
Mhm.
their A1C is not greater than 10. And I put that number out there. Some practitioners might start insulin at an A1C of 9. Some might just, do an 11. It just depends. Some people, we see some providers that send the patients with one pill or two pills, and their A1C is 12. And when they really could use some insulin. So it depends on the provider. But
Okay.
definitely, when the A1C is that high, insulin is recommended, and I'll tell you why. Because your metformin at maximum dose which is 1,000 milligrams twice a day. And some people can take a little higher than that, 2,500, but the usual dose, 2,000 milligrams a day, will only lower the A1C by 1.8%. So
Mm,
the A1C is so high, it's at 12, and you get a 1.8% reduction, then you're still at a 10. Your A1C is still 10. So it really, that person needs insulin.
okay.
Does that make sense?
Wow.
Yeah.
Yes, absolutely. Absolutely.
So
And
really
hi, Joe
go lower
Patterson.
the pill.
Welcome. Mhm.
You're depending on that person to make those necessary lifestyle changes. And if they don't, then they're going to be back, and you're going to need to start insulin later on anyway.
Mhm. And
Yeah.
you mentioned earlier, I believe it early on in you explaining this last question that I asked, one of my questions was actually going to be, does diabetes ever actually go away? Meaning, even if you're type 1 on insulin, and I think you might have answered that.
Yeah, so it's a chronic condition. Type 1, type 2 is chronic, meaning that it never goes away. However, it can be well controlled. Somebody, may be able to even trick their doctor. If they have a new doctor, if they're eating healthy and exercising, and they have an A1C of 5 because they maintain their blood sugars in healthy ranges, or 5.3, then, and they never tell their doctor they have a history of diabetes, the doctor would never know it, but they do. They have diabetes. Once you have diabetes, you always have it, but you can control it well. Now, if the diabetes is uncontrolled, however, that's when we start seeing conditions such as blindness, stroke, heart disease, kidney failure, and amputation. So that's why it's so important for people to eat healthy, exercise, get that physical activity you were talking about earlier, and take their medications as prescribed, and test their blood sugar. And when they're testing their blood sugar, you know, report those numbers back to your primary doctor, because if you are taking insulin and your blood sugar is not controlled with the insulin, which happens, and it's not anything to do with what you're doing at home. It may be that your medications need to be adjusted. So it's so important to follow up with the primary care doctor or your endocrinologist to adjust the insulin doses or medication doses, or maybe you need to add a pill to the metformin. But keeping those blood sugars between 80 and 180 is so vital to your health and your long-term health.
Yeah, and I know my A1C right now is about, I mean, I'm very proactive with my health, and my A1C is about 6, at a 6, about a 6.1, 6.2.
Very good.
And that's good. However, I am always striving to make it better, because it's like, Lord knows, I do not want to be a type 1 diabetic and have to take insulin. You know what I mean? I've already, praise the Lord, gotten over kidney disease, and I'm like, okay, this is here. I'll deal with this, but what can I do? And that's what I always tell people. You have to be proactive in your own health. You know what I mean? And not only in looking out for yourself, you need to look out for your loved ones too, your children and your siblings. And, you know, I mean, we can only do so much, but I just mean being encouraging to them to be better eaters.
Absolutely.
You know, especially if they've seen you go through something.
That's right. And Bella, you will always have type 2 diabetes. You'll never have type 1. If you need insulin, what happens is, you know, type 1 diabetes, the person, their pancreas doesn't work, and they need insulin for life. They never take pills. However, with type 2 diabetes, is different. It's progressive in nature. So when you're first diagnosed, maybe your A1C is you know, a little, you know, 6.6, and you're started on metformin. Go and fast forward 15 years. Now the pancreas is tired and is not making as much insulin anymore. So now, even though you're on 2 different types of pills for diabetes, your diabetes is not well controlled because your pancreas is just pooped out. So then you're type 2 diabetic, you know, requiring insulin.
Okay.
Does that make sense?
Yeah. And you know, that's why I'm so glad that you're on here, because I know for me, that hit me like a little, just not the kind of ton of bricks that kidney disease hit me with when I found that out, but I was like, oh, you're kidding me, you know. And it was so much to learn. You know what I mean? It wasn't making sense to me at first. And I'm like, okay, and this fasting number and this, I'm like, oh God, please, you know. But again, I came home, studied on it, read on it, and then it was more simplified. So again, that's why I tell a lot of people you got to educate yourself on it. That's what'll get you through it. When you understand it better, then you can deal with it better. So that brings me to my next question, Laura. What are some of the long-term complications of diabetes? If let's say it's just one of those situations that's not under really good control, and it's not that the person isn't trying, either be it type 1 or type 2, and is there anything that can be done, you know, that they can avoid getting, you know, to that point, even being on insulin, or you kind of explained that actually with the type 2. You were talking about exercise, changes of dietary changes. I do know that. But what about with type 1?
So with type 1, they will also, you know, do diet and exercise and their insulin and take medications. Now, not everybody can take metformin. Of course, metformin does have some side effects. It can cause gas, bloating, diarrhea, and some people. A lot of times, it's funny. This has never been like a thing. Like I mean, on the PI or the package insert saying that metformin people with that are lactose intolerant are more sensitive to metformin, but I've kind of found that in my practice that people that are lactose intolerant are more sensitive to metformin, and it's not written anywhere, but you know, that is certainly the case. Now, with your question was, how can a person with type 1 diabetes control their blood sugar? Well, there are lots of tools in the toolbox for type 1s. They have insulin pumps that they can use that will give them insulin all day without having to give multiple shots. They'd only have to get one, once every 3 days. Put a needle on once every 3 days, and also the continuous glucose monitor. Those are wonderful. And those are used by type 1 and by type 2, but they've revolutionized the world of diabetes because some people with type 1 diabetes tend to be a little brittle. So they'll have their blood sugar, and it's due to their insulin dosing, but their blood sugar could be really low and, down in the 40s, and then this jump up to the 3 or 400s, within a short period of time. So if a person has this continuous glucose monitor on, this will alarm and let them know when their blood sugar is dropping so they can stop it before it happens. So they can go ahead and find some juice or find some glucose tablets, and which is so important if somebody's behind the wheel, and their blood sugar is dropping low, then this alarm is coming out. They can pull over and have a snack, or it saves lives. This glucose monitoring system saves lives. I actually in the hospital was up on a transplant unit doing some teaching, and a patient shared with me that her blood sugar went low at like 3 a.m. and the nursing staff had no idea that the blood sugar was so low, and her sister had an app on her phone with the glucose monitor connected to it, and her sister in St. Petersburg's alarm went off, and her sister called the nursing unit and saved her. You see, if not, I mean, she would have dropped God knows how low because she couldn't. She was, she was unconscious with this low blood sugar. And so the nursing staff was able to run down there and give her, what she needed to bring her back. So it's really a lifesaver. That's the great thing that type 1s have: the insulin pump and the continuous glucose monitors. And yes, they control their blood sugars, with insulin. And can also, I mean, the former Miss America has type 1 diabetes. Halle Berry has type 1 diabetes. Lots of famous people live long, healthy lives. They don't have to have complications just because they've, had diabetes for a longer period of time. If diabetes, whether it's in type 1 or type 2, if it's well controlled, it will not cause any problems like any chronic conditions. You see, from chronic conditions as long as it's controlled, no matter if it's type 1 or type 2.
Okay. Wow. I'm really happy to hear about that pump. I heard about that. And I also heard about like that app where you can link a family member. And I think that's great for people who probably live alone. Oh my God, that is just a lifesaver. Jared, could you put Joe Patterson's question back up there, please? I think it was something that had to do with adverse reactions of metformin. I know Joe Patterson was asking a question.
Yeah, I saw some questions flashing, and I
Hmm.
kind of was
Yeah,
trying to read and talk at the same time. I was getting off topic.
yeah. I can't bring them back up. I'm asking my producer if he would put those back on the screen so we can see
I saw it a
what
little
was
bit,
said. It's,
something
I
about
think
metformin.
one thing was, I don't know if he was asking this or making a statement. I tried to jot it down on paper. Metformin has an adverse reaction on the kidney. So metformin has yeah, there it goes.
People with existing kidney disease, end-stage renal
Oh,
disease, if people that
okay.
their GFR is greater or less than 60, creatinine, high creatinine levels, existing kidney disease should not be on metformin. That's what it is.
Okay. Wow.
Not that the metformin is going to cause an adverse, event to your kidney. However, I will say that people that take metformin and come into the hospital should be aware that if they do have are scheduled for a CT scan, a CAT scan, like and they need to stop their metformin 48 hours after the CT scan. So the reason is because the CT scan dye is metabolized by the kidney. You know, your kidneys get rid of that dye, and the metformin is metabolized by the kidney. So that's just too much, too heavy on the kidney. So normally, what will happen? The doctors will give you, will let you know that you have to stop taking metformin 48 hours
Before or after?
after. So if
After.
you get to die, then you hold metformin for 48 hours. You don't take metformin for 2 days. So you give time for that dye to clear out of your body.
Okay.
Okay? Does that make sense?
Okay. Yeah. Mm-hmm. Yeah. Yeah. I
So,
understand. I
and
hope
I've
that
heard
I'm
that a
sure.
lot. And that's a great question that you asked.
Yeah. That's a real good question.
About if it affects the kidneys, because a lot of people, that I talk to that I've heard about metformin, and the doctor wants to put them on it. They're afraid to put it. They're afraid to start metformin because they're afraid it will affect their kidneys. But it is not um, uh, 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 causing problems with the kidney unless you already have existing kidney disease.
Okay. Because I was about to say, girl, you about to make me call my nephrologist and go off on him.
No,
What
no,
you put me
no,
on that
no, no,
for?
no.
And so, right. And so that, and normally I will look up things for myself always with regard to, let me see, what these side effects are, how this affects what it's supposed to, and how it's going to be a disadvantage. But I was sure he wasn't going to put me on anything, obviously, that
Right.
would
Oh,
so,
yeah,
and
yeah.
yeah, yeah, I see. Okay, wow, that was a really good question, Joe. Thanks for asking that. So, what should the goals be regarding? What should the actual goals be again regarding blood sugar levels?
So the fasting blood sugar, the American
Hmm.
Diabetes Association recommends your fasting blood sugar be between 80 and 130, and 2 hours after your main meal less than 180, and your hemoglobin A1C less than 7. Now, if you are able to, some other organizations, such as the American College of Endocrinology, recommends even tighter controls, such as a fasting blood sugar between 70 and 110, and 2 hours after the main meal less than 140. However, some people have, other conditions that may keep them from having such tight controls, and that's why the ADA recommends, like 10 points higher, 80 to 130, and then less than 180 2 hours after the main meal.
Okay. Okay. So here comes a question that I myself am very curious about. However, it will be helpful to my audience as well. Hi, Lisa. You said you have a chart. Good. um, I hear, and you being at TGH, you're in the thick of this, of course, because you're there every day. I am still, even though I cannot do my volunteering, of course, because we are totally on shutdown because of
We miss you.
COVID-19. I know, I miss you. Oh my God, we all miss you guys. We miss you guys too. We miss what we do for everybody and the transplant patients. And so, um, I keep hearing those that are more at risk, obviously, of it being, if COVID-19 is gotten by, certain people who are immunocompromised, lung issues already, and just actually quite a few other things that which makes you more susceptible to it. What I kept wondering, and they also mentioned diabetes. And so I kept trying to ask, we have a lot of those great seminars. In fact, we just had one last week with about 5 of the doctors from TGH on there, nephrology, Dr. Dana Reedy. Oh, okay, so it was great. However, I put that question in the question box, and I know it's only because I ask a lot of questions, and I guess they said, Bella, we ain't answering your questions, but the one I had was, and maybe you can answer this, how is diabetes directly an issue with regard to COVID-19? Does it have to do with the elevation even more of the glucose, or how exactly does that create more of a problem?
Well, persons with diabetes are more at risk because of, I'm sorry.
That's okay.
Sorry.
That's all right.
I'm at home. Okay.
I understand.
So
we understand.
Diabetes, and we've been told since this whole pandemic outbreak started, persons with diabetes are at higher risk due to them being compromised by other conditions. So you could, like, for example, and I know that kind of doesn't sound probably what you wanted to hear, but if a person has issues with their heart, for example, if they have diabetes, it's even worse. You see, because just because of the way diabetes affects the body. Hold on, I'm sorry.
Mm-hmm.
Sorry about that. So, if someone has a stroke and they have diabetes, then the likelihood of them having, more issues due to the diabetes is higher. So, and especially with persons who are immunocompromised, as you mentioned, persons with lung transplants and kidney and liver transplants who are immunosuppressed, they certainly have a harder time with COVID because, as they mentioned on that talk the other night, the doctors a lot of times will reduce their immunosuppression medications when they have COVID to help give their body a chance to fight it off.
Right.
So yeah, it's just the nature of diabetes. I mean, physically, the pathophysiology behind it, I don't know that I can explain that.
Sure, yeah.
I do know that folks with diabetes, again, if they have heart conditions, it's they have a harder time recovering from it because of the diabetes, and it's not just and it's not just because they have diabetes either. It is more likely due to a person who may be uncontrolled with diabetes, if that makes sense. So if for example, if we have a person going in surgery and for a cardiac surgery, we will make sure their blood sugar, any type of surgery, their blood sugar has to be pristine. It has to be really, really good control, because if not, then they have a harder recovery because of the high blood sugar. The high blood sugar will not, let them heal the way that they're supposed to, and that's likely it likely has a connection with the COVID. You see, so where normally people without diabetes will recover, but person, if their diabetes is uncontrolled, and we don't, there's so many people, like you mentioned, thousands of people with diabetes, you know, you can't pick and choose and say, oh yeah, you're going to recover from COVID because you're well controlled, but you're likely going to have a harder time with COVID because your blood sugar is always in the 300s, although that's really what it is. You see, because if someone has high blood sugar, what happens with them with the wound? The wound takes longer to heal, right? And if a person has like a flu and they have high blood sugar, then they stay longer with the flu. If a person has an abdominal surgery and has an abdominal wound, and they come out and have high blood sugar, what happens? It takes that wound longer to heal. So person with COVID, and so that's the connection. If a person has diabetes already and it's uncontrolled, then the COVID's going to hit them harder. If that makes sense.
Yes.
It's some pathophysiology or anything, but I try to explain it on a level, you know what I mean? So it's easier, to understand. And that's how I see it.
Yes, absolutely. And guys, this was a webinar that Laura and I were in, a TGH webinar with 5 of the top doctors at Tampa General, and it was exclusively about transplant recipients. So the information was amazing. And one question that I did ask that I felt was important was, how, if in the event that a transplant recipient acquired COVID-19, how are you guys treating them? What is their treatment? And it was stated pretty much what Laura said. Well, they said that our treatment is really no different from the other patients. However, what they do have to do, they found, is take us off those immunosuppressants for a few days, because that our body, of course, keeps our medicine, keeps our immune system low. Therefore, as you guys know who are recipients, we can't fight anything. It's like two entities fighting against each other. So they have to take us off the meds for a couple of days so that our body can start to fight the disease. And even for us, that's not an easy task, because those medications are really in our system. You know what I mean? So it takes a minute, but I'm sure in conjunction with antibiotics, whatever they're giving or whatever else they're doing, it seems to be working really well. And TGH is definitely ahead of the game. They are on top of it, for sure. And they've actually said that they haven't had a whole lot of recipients, thank the Lord. There's been some, but not a whole lot. So that was really comforting for me to hear, and just to also know that they do have a plan, that they know how they would deal with it. So tell us a little bit, Laura, about a good diet. What is a suitable diet for a type 1 or type 2 diabetic?
So pretty much type 1 and type 2, I generally speaking would just need to watch their carbohydrates. Carbohydrates are foods and starch, such as starches, fruits, and milk. Now, the type 1 is going to be in a using carbohydrate counting at a higher rate than I shouldn't say that like that. The type 1 is going to be using carbohydrate counting with insulin dosing. That would be the main difference. So, like for example, if they had like a slice of bread, for example, a slice of bread, 2 slices of bread, and a piece of fruit and a glass of milk. They have 4 carbohydrate choices there. And if their ratio or insulin to carb ratio is 1 to 15, they would take 4 units of insulin for those 4 carbohydrate choices. Whereas with type 2, it's not you're not doing insulin to carb ratios. You're mainly just counting your carbohydrates. And for women, you want to try to stick to less than 45 grams of carbohydrate, 45 to 60 grams of carbohydrate at each of 3 meals. And for most men with type 2 diabetes, generally speaking, 60 to 75 grams of carbohydrate. And we separate those carbohydrate into carbohydrate choices, where one choice would be 15 grams. So if you have a small fresh fruit the size of your fist, that would be 1 carbohydrate choice. If you have a slice of bread that, just white bread or wheat is going to be healthier. Whole wheats, always choose whole grains before you choose anything else. And when it comes to pasta or any type of thing made with flour, you want to choose whole wheat first. But if you have 2 slices of bread, then now you have 2 carbohydrate choices. So each of them are 15 grams of carbohydrate. So that, that sandwich would be worth 30 grams of carbohydrate. And if the limit is 60 grams, you can, again, add a piece of fruit and and a glass of milk to that meal. So, that would give the 60 grams of carbohydrate. In addition, so you're not just going to have the bread, the starch, and the fruit. In addition, you're going to add some protein, and protein doesn't raise blood sugar. So you want to make sure you get your protein in there, about the size of your palm without the fingers, or the size of a deck of cards, a piece of protein, and the protein is going to be either meat, eggs, or cheese. And then you want to add some non-starchy vegetables. As you mentioned earlier, the non-starchy vegetables are great. You want to add those, fill half your plate up with non-starchy vegetables, because non-starchy vegetables are not only good for you, they fill you up. So then you won't be eating too many carbohydrates, because the carbohydrates, unfortunately, do raise blood sugar. They're good and healthy for you because, carbs are found in fruit and milk, and those are always, those in whole grains, those are healthy foods. So you don't want to eliminate carbohydrate from your diet. Just, continue to have it in moderation.
Mm-hmm. And so, Laura, what and tell a minute about sweets in relation to being a diabetic. And it doesn't necessarily mean that you can't have sweets. And please add in about alcohol consumption.
Yes. So with sweets, we'll start with sweets. Sweets, you can have them, but I like to tell people, instead of having, like an ice cream, choose a piece of fruit, because that's sweet too. That is a carbohydrate. And so replace your dessert with a piece of fruit. When you want something sweet, have a piece of fruit. Now, if it's your birthday, that's a whole different ball game there, right? So then you want to go ahead and have your cake, but have a smaller piece of it and make room for it. So like if your limit is 60 grams of carbs at each meal, so have 30 grams of carbs, and then the other 30 grams are your sweet. You see, so you kind of exchange. If you're going to have a cookie, you really wanted this chocolate chip cookie, have it. If it's 30 grams of carbs, take out the milk and the fruit. They're healthy, by the way. Take the milk and the fruit out and have your chocolate. This way you get it out of your system, you have it, and you're done. But for the most part, when it comes to sweets, just use your fruit as your dessert. And fruits are very sweet. When it comes to alcohol, I mean, what the recommendation is one alcoholic beverage for women, one per day. One per day, and for men they can have two per day. But when I see that, I think, it's kind of like a cigarette. If you're going to take a cigarette, one cigarette each day, by the time you build up, you're going to end up with lung cancer or something. So if you take so much alcohol, if you're going to drink one drink every single day, I mean, what is that going to be like on your liver? So,
right.
or two drinks every single day. I say moderation is key, and you don't want to binge on the weekend or anything by any means. But if you're at a party, one drink for women and two for men is the max for folks with diabetes.
Okay.
And there's beer has carbohydrates in it. Hard liquor does not, like a rum or whiskey. There's no carbs in there. However, people tend to add things to tequila, like to make margarita, and that's where the sugar comes in. Or they'll add some Coke to that rum, and now it turns into a different thing. So
So it sounds basically like what it's really about is also having discipline in calorie counting. You have to really count those things that you're eating, so that you don't go overboard.
That's
with
right.
those carbs, with those sweets or whatever. And I know that can probably be challenging. However, when you get in a regimen with it, it does become a little easier. It does become a little easier. Lifestyle. It is definitely a lifestyle change.
So like for women, we get 1,600 calories. So if you break those up and say, well, I'm going to have 400 calories for breakfast, and you think it's mindful eating. You think before, you start planning your meals, and you think, okay, I'm going to have some oatmeal. That's about 100 calories. And I'm going to have this thing, and you just start forming your breakfast, and it becomes habit. And then you don't want to go over like 400 or 500 calories at lunch or at dinner. You see, and then you're at your 1,600 calories, and you just kind of remain there. Make it a lifestyle change.
Right. I know often as diabetics, we're told that it's a good idea to lose weight. However, when you are a kidney recipient, this is definitely more difficult.
Challenging.
I know that has been, and as a woman, and a woman of 58 myself, those other things befall upon us as older women, menopause and all the little wonderful things that come along with that. But also, again, the Prograf, that is one of the side effects of Prograf, is weight gain. So most doctors are big on weight loss for multitudes of health issues, heart related, whatever. And it does make sense because it is true. I know myself, I am someone who's very athletic. I am into working out. However, I do not lose the kind of weight that I used to lose 7, 8, 10 years ago. My body just does not work like that anymore. My metabolism is not what it once was. Therefore, I myself work out more so to stay in shape and not to gain any weight, and because it's good at keeping, if I'm not mistaken, our blood pressure lowered, definitely trying to keep the diabetes under control, as well as lots of other things. So what do you suggest? What do you tell, your patients, if any have ever asked, that are good alternatives if weight loss, the kind of weight loss isn't achievable, that would probably do great at lowering that A1C?
Say that, I'm sorry, your question again was?
Yeah, what do you tell your patients who maybe, if any, have asked you, or as I am asking you right now, if you cannot really achieve weight loss, what are some good alternatives, something maybe you can pump up more to help or whatever to get that A1C lowered? Is it just pertaining to diet at that point, or what would you suggest?
It's a combination of all of it. I mean, you're you're absolutely correct in saying that, once we get to a certain age, our metabolism slows down. You don't look 58, by the way. But I know what you mean. Years ago, the same thing. I could just, put it on and then take it right back off in a couple of months, but that's not the way it is anymore. So,
Right.
If a person wanted to achieve, if their A1C was high, but weight loss was something, it takes time to lose weight. A healthy weight loss anyway, because you lose like 1 to 2 pounds a week, right? So, but what if a person had 50 pounds to lose and then their A1C was high? That's your question, right? How do you fix the
Correct.
A1C
Yes.
then?
Yes.
So it definitely, you want to eat a low carbohydrate diet, number one. But that's not all. It is important to exercise, as you mentioned, because food raises blood sugar and exercise lowers blood sugar. You see, and lowering your blood sugar, you'll lower your A1C automatically. And take a check with your medications. So if your A1C is high, and that, like that scenario I mentioned earlier, you've had diabetes for 15 years, you're taking only one pill for diabetes, and now your blood sugar is not controlled. Well, it might be time to think about adding a second pill, or talking to your doctor about adding a second pill or an injectable. There's a wonderful injectable called a GLP-1, and you've probably heard of them. The Victoza and Bydureon is one of them. Trulicity. These are injectables that are not insulin per se. But they are hormones that our body produces that are deficient in type 2 diabetes. This injectable can lead to weight loss and can help control the blood sugar. So if someone is struggling with weight, I would definitely, and they're not on a GLP-1 and just on one oral, I would definitely have them talk to their endocrinologist or their primary about looking into, a GLP-1 to see if that's right for them, if that would work for them. So it's a combination of things. It's meal planning, exercise, medications, and monitoring. A lot of times people's blood sugars are under control and they don't know why. And I talk to them and they only testing their blood sugar 3 times a week. You can't control what you don't know. You see, if you never got on the scale, you never knew that you gained 5 pounds. So what's not measured is not controlled, in other words. And knowledge is power. When you're learning about diabetes, you learn, but knowledge without action is useless. Right? If you know all these things, but you don't put it into good use, then it's not going to work. Right?
Wow. That's right. That's correct. So true. Jared, do we have any questions for Laura in the queue? I know sometimes I miss one or two.
Yes,
Knowledge is power. That's right. Yeah, that is so true. So very, very true. And I will ask this, for those that may have children that are diabetics, or even, again, not just about what's at your home, at your kitchen table, but maybe a person can help a friend. Are the same things you shared with regard to diet applicable to kids as well? Diet and exercise?
Diet and exercise, yes, but children should not have when they're older, teenager, they're pretty much developed. Okay, they can go on, they may be on like a carb counting or a calorie restriction if they're, struggling with weight. However, young children, they usually will not restrict any calories in young children. That's not to say that we should give them lots of juices and things like that, and too many sweets and things. No calorie restriction, but I certainly, there's a question there. Would you recommend
Yes.
an injectable over a second pill for stubborn A1C? The newest guidelines is actually has the injectable at a higher level. I mean, they're recommending first line, the injectable and the pill. So that if the doctor wanted to, they could go ahead and instead, in lieu of a second pill, they could start an injectable to help lower the A1C, most definitely. And it does help with weights. Laura, visit schools for PTA for parents. No, I with the whole COVID thing, I don't know what the future of our schools are. I don't know. Yeah, but I haven't.
Yeah.
I haven't visited any of those things. Yeah.
Yeah. Yeah.
Yeah. So,
And
but for children, I know that our dietitians never do calorie restrictions. They do pediatric diets. So just food without lots of concentrated sweets. Cookies, cakes, pies, candy, these types of things, and milk and instead of juice.
And I would think too, I don't know if you would agree with this, staying away from a lot of processed food.
Absolutely. Absolutely. Those things are not good. They're full of sugars, sodium, things that are just known carcinogens that are not good to consume at all. So natural foods, fruits and vegetables, and I struggle with eating fresh vegetables because I feel like when I buy them, and my patients tell me the same. I buy them and then they go bad in a couple of days, and I think it's just the whole process of it all that by the time it's picked and then packaged and then transported, and then it sits in the store, and by the time it gets to me, the shelf life is 2 days, and my strawberries are already rotten in my refrigerator. So I tend to buy frozen vegetables and fruits to get my fruits and vegetables in. I'll buy frozen ones, and I see that they last longer, and I can still have fresh fruits and vegetables not fresh, frozen ones on my plate. But at least I get them in.
Yeah.
And I just have to be careful buying fresh fruit because the shelf life is short.
Correct. Yeah, and that's what I am, more of a fresh fruit girl, but I have a really good friend here. She will buy her fruit frozen. And because see, in my mind, I guess I'm processing it as fresh is the best. You know what I mean?
I agree.
It's the best. And frozen oftentimes, even though it's probably not as prevalent in fruits, but does come with frozen fruits, but does come with a lot of stuff to preserve it, to be able to freeze, to be frozen. And that's what concerns me and why I tend to kind of stay away from that. I just kind of feel like but like you said, bottom line, that there's a much shorter life with fresh fruits and certain vegetables as well. So I'm only buying 1 week's worth myself when I'm buying them, and I juice. I juice, so I'm using that stuff a lot quicker.
Yeah, we have a big fruit basket. Having 4 daughters, and that fruit goes quick. It rarely goes bad. But like the broccoli and things that they're not loving, that goes bad in my vegetable drawer. Yeah.
Right. Any more questions, guys, before I let? Okay. Oh, Candy's saying go to Whole Foods, Trader Joe's, or your local farmers market. They last for several weeks. We belong to CSA. Oh, thanks, Candy.
If you freeze your own, and then you're eliminating the preservatives in there. We have a mango tree that all the mangoes are ripe at the same time, and we cut the fruit off. We peel them and we freeze them, and we make shakes for the girls. Just put some milk and sugar in there, and it's all good.
Wow, awesome. So wow, you have been so great, Laura. I mean, this just has
Thank you.
been a wonderful plethora of information, not only that I can use, it wasn't so much for me. I had done my diabetes education, but I'm just so grateful that so many have been enlightened by what you shared. And so I would just want to just close with asking you, is there one thing that you find with regard to you educating patients that you tend to have to really continue to reiterate a little more, to kind of like, hammer in there, that, you know what I mean? Because what I'm trying to think, what is that one thing that everyone generally, or not everyone, but a lot of diabetics have an issue with? That's what I wanted to ask. If you could share what you feel it's in your experience that has been.
You mean when you say they have an issue with it, issue
They have
understanding or an issue
trouble
with
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 compliance.
compliance? Um, I would say, um, in regard to compliance, I would say monitoring the blood sugar.
Mm.
And one would think diet, but I think that people fall off and they just don't test their blood sugar as often as they should. And again, what's not measured is not controlled. So they don't know when their blood sugar went up to 300. I would say, monitor, 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 and because without that, you're not going to know, or be able to pick up on things. Um, Diet is big, though.
Yeah.
It's huge. It's cornerstone, and people, they do good for a little while and then they fall off. So it's kind of it's those are the top two, I would say: monitoring and meal planning. People take their medications, they want to get better. Most of us do.
Yeah.
Most of us will take the medication. You even if you're not eating healthy, you say, well, at least maybe this pill will do something because you didn't eat healthy or whatever. But I would say monitoring faithfully and writing your blood sugars down, and the diet, because it's not easy. Pricking your finger every single day, multiple times a day, is not easy. I can definitely understand that, but worse off is if what could happen if the blood sugar is uncontrolled for long periods of time. That's even worse. So I would say,
Exactly.
continuous
Yeah. And
glucose
I
monitor.
Right, right. And thank God that medical technology has come so far in so many aspects, even with regard to what you said regarding the finger pricks. Now they have
Yes.
for those who need, I don't have to do that every day
Yeah.
myself, but they have the patch where you do it in your cell phone and it's just
That's right.
amazing. You don't even
That's right.
have to worry about those pricks anymore. They may be a little more expensive, but in my opinion, it's worth it. If you
Yes.
don't want the hassle, yes, Lisa, I don't like that prick thing either. It's not that it hurts
I
per
know.
se,
I
you
know.
know,
People
it's
don't
just a
love pain.
nuisance.
Yeah.
Yeah, yeah. So I totally agree with that. And I think that we're all struggling a little bit trying to maintain dietary
That's right.
regulations in light
Whether
of
you have
COVID
diabetes
and
or not.
right, and isolation. I mean,
Yeah.
I think that's just a problem for everybody right now. However, I do feel that it's critical for those us that are diabetics to really try to stay the course as much as we can,
Absolutely.
because of what all the things that you just shared. I know that there are, and we didn't talk about this, but even those who, I guess things get so bad where some of them go into a diabetic coma, I believe it's called.
Yes.
That's,
Yes.
that sounds scary.
Yes, yes, it is, and that could happen if a person's blood sugar is so high, and
What would that level
it
have to
actually
be?
happened to my neighbor, one of his sons, my across the street neighbor. um his son went into a diabetic coma, and he never came out of it. So it's real. It could
Mm.
definitely happen. And I mean, it could happen with either high or low blood sugar. So it's
Mm.
keeping that balance, keeping the balance.
That, yeah, we didn't touch on that, but that was that's a good one too. I didn't even think. We always think high blood pressure, but there also is that one. I believe it's called hyperglycemia when it goes
Hypo
too
is
low.
low.
Hyper is up, hypo is low. Hypoglycemia when it's too low.
That's right.
Yeah, yeah,
Yeah.
and that can
So
be dangerous too. Correct?
that's right. Especially, and it could happen. We see it happen a lot with people that are trying to get good control of their diabetes, and they just kind of overshoot their insulin, or they go ahead and they take their pill and they go out to exercise and they didn't eat. Person that takes glipizide. Glipizide is a pill that makes the pancreas make more insulin, that kind of stimulates the pancreas to make more insulin. And so if this person got up in the morning first thing, their blood sugar's low anyway, and then they go ahead and take this pill, and they're supposed to eat in 30 minutes, but no, they go out and start exercising because they want to lose weight and stay healthy.
Lower.
Yes, and then they end up
Yeah.
with low blood sugar, which can also be dangerous and could lead to a diabetic coma as well. Overshooting the insulin or the medications. Definitely.
Yeah.
So
Wow. 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 Well, you know what? Thank you so much, Laura, for your time. I know you got a busy household. I know some of the girls have probably been coming to the door a little bit,
yes,
so I won't keep you any. I won't
it's
keep
okay.
you any
I'm used to
longer.
it. I hope you all
But
didn't mind.
not at all. No, thank you. We appreciate you and your time for what you do, because I know you do this. This is how your day goes. You're educating. So I just thank you for taking the time to come on here and educate my audience. And we just really appreciate you. Thank you so much.
Thank you so much for having me. Thank you.
And God bless you, you and your family. Stay safe. Have a great night.
Same to you. Good night.
Okay. Bye-bye. Wow. So guys, that was some great information. I mean, there were some things that I even learned in that I did not know. And I apologize if there was anyone dealing with hypoglycemia, which I forgot about, the low blood pressure, which affects a lot of people too, but nothing like the hyperglycemia and, of course, the diabetes issue. So I think that the greatest thing, as Laura said, that we can learn out of this is, as diabetics, maintaining a good and healthy diet and exercise. Now, I know the beginning of COVID, the isolation, I had to do whatever exercises I was doing in my house, and I got so sick of it. It was until my doctor, my nephrologist, asked me what I was doing with my last appointment with him in March, middle of March. And I said, I have been on lockdown because I was literally terrified about being outdoors too much around so many people. I would just go get my groceries, obviously masked up, gloved up, like I was working for the CDC, and and go and get my stuff and hurry up and get out. But you know what? He said, I want you to kind of still stick to your routine, but do it safely. We have parks where not a whole lot of people are always just crowded. Just go for a walk somewhere where is a little more secluded, safe, but a little more secluded. And if someone is approaching you, other people walking, whatever, slap your mask on, and I do power walking and everything myself. So obviously having a mask on consistently is very restricting to my breathing flow, my rhythm. And so that's what I would do. I take it off when there were no people around. And when I saw others approaching me from the other side, I just put it back on. Isolation can be very dangerous mentally. It can mess with your mind, and we don't want that. So I would say just try to do as much exercise as you can. If you can't go out, 30 minutes in the house is great. You can do that. We can do something. Please pass this on, share this so others can learn from it as well, guys. That's what we're doing out here. We've got to get this word out to everybody. And our children, this is for our children and our grandchildren, because we don't want to see them suffer with anything like this. So please pass this on. I like to always leave with the scripture that is in relation kind of to the show, whoever I had on the show. And since this was about health, I want to share with you guys 1 Corinthians 6:19 through 20. And this is the ESV version of that. Did you know that your body is a temple of the Holy Spirit within you? And when you have, and when you, whom, excuse me, that you have from God, you are not your own, for we're bought with a price. So glorify God with your body. It's plain and simple. He made it real simple. We have to take care of our body because he gave this body to us, and he wants us to be healthy. Glorify your body. Take care of yourselves. Do the right thing. I love you guys. Until we meet again, have a wonderful night. Bye-bye.
Oh, I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who have not kept them. I don't want money. I don't want cars. I don't want money. I don't want cars. You are, that I'm the best is too fast. The truth wrapped up in excuses. You are the weeds that pull their group back. The strings upon my heart, but you know that. Cause you pull them, yes you pull them till I cry out.